little bit about what the situation is with COVID-19 over at your hospital?
So what we're seeing in our community is that there is a significant increase in terms of the number of positive cases in the community. We're seeing as high as 25% positive rate on any given day. It's spreading very, very quickly. We have a community that unfortunately has some health risk just as a general population as a base. And the Delta variant is taking a toll across our community. Today in our hospital, we have 59 COVID positive patients. That's the highest number we've ever had since March of 2020. For the month of August, we've had more deaths in 1 month related to COVID than we've had since March of 2020. So we're seeing, it be what I consider a crisis for our community, in that we have so many people that are positive. The spread is very, very high, and unfortunately, people getting very, very sick as a result.
And for the last couple of months, people in public health have been pushing for vaccinations, protecting yourself, doing
Right.
everything you can to reduce the risk. And we just keep seeing these numbers go up and up and up. How frustrating is that for you, for somebody who's working in this field, seeing that every
Yeah.
day?
Yeah. Well, it's very frustrating. I've had several posts on social media recently, and in one of them, I even said that I thought I was failing. I was failing the community. I was failing my team. And I feel like I'm failing in many ways, because if the community is not responding to what the health professionals are advocating, which is vaccines, social distancing, being socially responsible with masking and that type of thing, then somehow we're not getting the message across so that people are adhering to what we're asking them to do. The county that I serve has the lowest vaccination rate in the state. So we start from a very vulnerable risk population. We have, I think we're at about 30% right now that's vaccinated as a total population, and that just puts us at extreme risk. Yeah, it's very concerning. It's saddening, actually, to know that there are ways that we could lessen the severity of the COVID response. The vaccine is not going to stop you from getting COVID necessarily. It's going to prevent you from having extreme illness from it. And we're seeing that played out. Those that are vaccinated, we have very few of those that end up in the hospital. But we do have some that have breakthrough cases and actually are positive, but their course is shorter. The symptoms are less severe. We've never had a vaccinated person to date in the ICU, and we've had no deaths from a vaccinated person. So it tells me that the vaccine helps to protect us from severe illness.
And one of the posts that you posted a couple of days ago was of that mobile morgue, kind of a grim picture of the reality that you guys were seeing there
Right.
on the ground. Tell me a little bit about, what, pushed you guys to have to order that, and if that's filling up, if that's also filling up right now.
So what pushed us to do that is we did see that the number of deaths were increasing over the last week. With that, the capacity in-house was getting close to full. We didn't want to wait until we had our in-house capacity completely maxed out and then have to try to figure out what to do in case we had other deaths. So we did work with the North Carolina Office of Emergency Management and procured the mobile morgue as a precautionary measure, if you will, just to make sure that we had access available if we needed it. To date, we have not had to use it. In-house, I have the capacity for 12 bodies. Today, I have 11 in my in-house unit. So I'm reaching capacity once again. So the fear is that over the next couple of days, we may have to use that mobile morgue as a holder until a funeral home can actually come and pick up the body.
Yeah. I mean, if you have room for one more, I mean, it's, likely that you guys will have to use that here in the next couple of days, especially with
Right.
these numbers.
Right, exactly.
And it seems kind of ironic. People are not trusting public health officials when they say get your vaccine, but when they're in the most dire situation, they do trust you guys to try to save their life when they're really
Right.
sick. It's gotta be a weird situation to be in, because you can't point the finger and say, well, you should have done what we said, but you still have to care for these people. It sounds like a tricky situation to be in.
Well, it is a tricky situation, and I know that there's lots of conversation going on in the community about vaccines, and just had a conversation with an employee this morning who is unvaccinated to date. She's trying to make the decision to whether vaccinate or not, and she's afraid. And I said, "Tell me what your fears are." And she said, "Well, I've done some research." So her research is online. "I've done some research and I have some concerns about some things that I've read online." And I'm like, okay, I understand that there are a lot of things that you can go online and access information and everything, but can I address some of your fears? And, she's read a lot of things about the potential that there's, which I'm sure you've heard this, that there may be a chip that's being implanted. And I'm like, and then there's going to be tracking. And I'm like, we're talking on a phone, we're being tracked right now. Anytime you purchase anything, you're being tracked with what you're purchasing. I'm not sure what that is, but to my knowledge, there's no chip inside this vaccine. This is a liquid vaccine that we're putting in, just like flu vaccine or whatever. But there's that fear. And it was a good conversation, but I just think there's a lot of misinformation out there that people are listening to. My goal is just to be able to provide them with accurate information about what's happening in our community. I think sometimes we get isolated too, and we think, well, we're here in Robinson County, North Carolina, and we hear these things on the national news, but it's not happening here. It is. It is. We have a spread that's wild, and we have a lot of people in the hospital, and we unfortunately had to get a mobile morgue, and that's happening here to our population. And I just want them to take heed and understand that, we can do something about that. There are tools that we have available to us. One is the vaccine. That's certainly one that I'm promoting very heavily. I'm not getting anything from the government to promote it in any way. I just know from a healthcare leadership perspective, I have an obligation to make sure our community knows what we as a healthcare system can do for them. And then, wearing a mask, being socially responsible with our interactions with people, and washing our hands, those basic things can help us stop this spread. And I'm just pleading with the public to heed that advice and do it as soon as they possibly can.
And you guys are at the point where you can't even help other facilities, right? I read that you had to tell another facility, we can't take any of your transfers. It sounds like that's what a lot of hospitals are having to deal with right now. So that's a hard spot to be in.
Right. You hate to say to another facility, no, I can't take your transfer. But we've been in the same situation where we've sought the ability to transfer a patient to another facility and have been told the same thing. So it's not necessarily unique to us. Unfortunately, it's a problem across our region. It's across the state. We're part of the UNC Health System, so we're trying to coordinate within that 15 hospital system to see where beds are on any given day, and do we have the ability within that system to help one hospital over another to possibly get a patient in a bed. So we have the ability to do that as a part of that system. But the reality is we're all dealing with healthcare worker fatigue. The staff's exhausted. This has gone on for 18 months now. And when you think about the ups and downs, the emotional toll that it's taking, the physical toll that it's taking to put the equipment on to take care of a COVID patient, it's just hard. It's stressful for everybody. Our social lives have been impacted by this. So we've got stress at home, we've got stress at work, we've got stress everywhere. And it's just taking a huge toll on the workforce. I worry about my workforce. They come every day expecting to do the best they possibly can for anybody that needs our care. And they do that day in and day out. But we need help from the public. We need the public to step up and do their part, which is, the socially responsible thing to do, of taking the vaccine, of wearing the mask, washing your hands, being socially responsible in your interactions. That's really what we need everybody to do to be able to get beyond this. My obligation is to have access to healthcare. I want to have that access. I have to have the people to do it. When I think back over the past 18 months, I've had over 600 employees out for quarantine because they came in contact with COVID. Those are 600 people that could be working, but they can't because they came in contact with COVID and had to be quarantined. So it's impacting us in so many different directions. And, my post started a couple of weeks ago because of just out of frustration, because I didn't know what else to do. I just felt like I needed to say something to somebody, so why not say it to the world?
Yeah. And a lot of times people trust the message coming from people who they know directly. So maybe if you have a friend on Facebook who's unsure and they kind of see your own experience,
Yeah.
maybe that'll convince them.
Well, I'm hoping I can influence somebody. If it's one or two people, then that's one or two people that we didn't have before. So, yeah, it's just my plea and my way of trying to describe to them, what we're trying to do and what they could do to work with us.
And for people, folks like that staff member you mentioned who are online researching, but maybe not finding the right information, what advice do you have for people on how they can find the right information, who to trust, and how to know if something is myth or fact?
That's a tough one because everybody is going to trust their resources and their circle of influence. So they're going to go to their circle of influence first before they reach out to other people. But what I'm telling our team today is if they're unvaccinated and they have questions about the vaccine, the executive leadership team today and tomorrow are making ourselves available to talk one-on-one or in small groups with employees who have questions. And we're going to give them what we know as facts and answer any questions that they might have from our perspective. We put in a mandate for vaccines that will be effective September 21st. So my team right now is having to make a decision on whether they're going to take a vaccine or not. And I just want them to do it based on the scientific facts. So we will give them resources and have the conversation with them about why we made that decision to put that mandate in. It's not to be punitive. It's not to punish anybody. I don't like telling people what to do. I want them to be able to make their own decision, but for us to have a safe work environment and to be able to interact safely with the community and that type of thing, I felt like it was the right thing to do.